Welcome to Beyond the Article, Health and Communication Distilled, a podcast of the Journal of Communication in Healthcare, Strategies, Media, and Engagement in Global Health. Each 10-minute episode features conversations with our authors on translating their research findings into practical and policy recommendations that will ultimately improve patient, community, and population health outcomes.
Hello and welcome to Beyond the Article, Health and Communication Distilled, a podcast series of the Journal of Communication in Healthcare. My name is Dr. TJ Jirasevijinda, and I'm the Special Sections Editor, Patient Voices and Interviews, and Editor Emeritus at the Journal. We have with us Dr. Liliana Abreu to discuss her work titled Patients' Perception of Family Engagement in Health Information Practice, Influences on Self-Management of Asthma, that was published in volume 13, issue 1 of 2020. Hello, Dr. Abreu. How are you doing?
I am good. Thank you so much for the invitation to be here and talk about our study.
Would you, to start off, provide a summary of your study, including the results and some of the implications that you see?
Yes, so this study is actually a part of a larger project named Evaluating the State of Public Knowledge in Health Information in Portugal that was part of the Harvard Medical School Portugal program. And the main objective was at designing a strategy and tools for assessing knowledge on health of the Portuguese population, including asthma. And as we know, it is a universal health problem and it affects 6.8% of the Portuguese population. While we were investigating these pathways of health information behaviors in the context of asthma management, we learned that family involvement and influence in health information seeking behavior was quite important for our sample, for our participants. And so we defined a very specific objective that was to identify the influence of family involvement in asthma management, particularly in terms of health information seeking behavior in patients living with asthma. So on one side, we have the group of participants that told us that they never searched any type of information about asthma. And then we had on the other side, a smaller group of participants that told us that they did actively search health information. And we wanted to understand what were the characteristics that distinguish and that were similar in this group. And we realized that in this group that never searched health information about asthma, they had all of them asthma in the family, and all of them related. I didn't felt the need to know more about asthma because I already know everything about asthma because my father or my grandfather, so close relatives, lived for many years with the disease. And then on the other side, we had people that searched about it, and they actually told us that it was really difficult to cope and accept diagnosis, and that they deny actually the condition in the beginning, and they were not at all familiar, and none of them except one participant had no asthma in the family. So we started on that, and we start building the profiles and try to understand what were the patterns in terms of these profiles and in terms of sources of health information that each one of these groups were using.
As far as the study results, what struck me the most is how clearly your group was able to distinguish between seekers and non-seekers. Did this come out as surprising to you?
Yes, it was a surprise to us when we realized that somebody that has close relatives with asthma in the family, they very consistently do not search information about asthma anymore. But at the same time, there is also the downside of it, where they always saw their familiars or relatives living with the condition badly managed. So they assumed that that was the normal, that was the expected. And even if they could not manage their condition, they assumed that there was nothing more they could do And like this, they could be ignoring other treatment ways that they can improve their quality of life. But in general, this is a good thing. So this is something that it can be used more in medical interventions. The thing is that the familiars, the relatives should be more included in this type of treatments, and they could help each other actually to have a better management. But of course, we were surprised about this so defined and dichotomic groups. And then on the other side, people that never had any close family members with asthma, they experienced much more anxiety and stress. They denied, some of them only 3-4 years after diagnosis, they realized that, okay, maybe I should really start doing something about this. And they also searched information about the medications. They saw many information about the side effects. So they didn't want to take the medication because they were afraid of getting addicted to the medication. For example, it was one of the information they found online. So there are these types of characteristics. But what's also surprised us is that, for example, the socio-demographic characteristics. I mean, on one side, we were expecting that the youngest generation, they are more digital, so they can more easily search information online, mostly the group of seekers. And then we have the non-seekers that have lower levels of education and lower health literacy levels, and they are older, and they do not have those skills to search as much as the younger. So that part was kind of expected, but the other characteristics were quite surprising.
Would you describe a little bit about how the findings will impact how we interface with patients, right? For instance, I'm imagining, do I need to screen out patients and really, in some ways, quickly define them as seekers and non-seekers? And what would be my approaches to educating them?
So I think that's trying to understand what type of patient do you have. If it's a patient that goes and always search for information, or if it's a patient that has a more passive attitude towards the condition, I think it will help you to try to understand what is the best approach. For example, I would say that for the patients that have a more passive attitude and also have some family members that have asthma, as well, I think that the best recommendation would be to include those family members and also to try to discuss more the experience of others and try to compare with the own and bring them more together on that. And for example, on the other group of the patients that it's like the first time that they are dealing with the condition and they feel more lonely, more anxious, I would say that this type of patients, they would need more support in terms of emotional impact of a diagnosis of a chronic condition, and also some guiding in what are the best sources of information, of health information that they could use. So that would be important for them to have this type of guide from the doctor, which for all of them, all our sample, the doctor is unquestionably the main source of information. I am completely from the opinion that these are not static profiles. So somebody that never search health information, if he gets the right sources that match their skills, that they can actually do my own research and know a little bit more about it. So I think that they can easily switch from non-seekers to seekers.
That's awesome. I think your comment about the fluidity of the characteristics of people over time, I think is a huge silver lining and points to the importance of, patient education, family education and stuff. One other question I have is, when you're talking about seeking information on the internet or the media or family, etc., to me, all of these things hinges on the feeling of trust. I wonder if you have any comments about how trust could be established in this sort of setting.
I mean, I think that it depends a lot on the legitimacy that you bring from the person that gives you the advice, I would say. For example, close family members are quite legit for the patients, and we saw that in our sample. And the doctors are also very trustful sources. The good thing is always crossing some of the sources. For example, crossing some of the information they found online, and they could, for example, ask the doctor about it. If you do small, very quick questions to the patient, you have the feeling about what are the sources they trust more or not. So trust is very important.
Yeah, excellent point. You talked a lot about anxiety, nervousness, feeling overwhelmed. And I think mental health issues are very important in chronic care in general. And when you couple that with the overwhelming amount of information on the internet and not necessarily knowing where to turn to, that becomes even magnified. Would you just elaborate a little bit on that mental health issues?
Yeah, so it's many patients told us about the anxiety they felt, but anxiety can actually stress and cause asthma attacks. So it's like a circle. So if they are anxious, they start to feel symptoms more, they have more crises. It's something that should not be overlooked. The stress that the patients felt when they are diagnosed with a chronic condition as asthma. And one of the patients, he told us, because this involves what is more important when for a human being to be alive, which is breathing. And the lack of capacity of breathing causes a lot of anxiety when they experience these symptoms. And for me, it was quite illustrative about the stress that this can so easily cause them. And for example, with younger participants of our study, they also felt a lot of anxiety to have a normal life, to go and play football or to go surfing. So can I go surfing without knowing that I will experience some type of crisis? All these normal daily activities in the beginning, when they start to realize that this could have some impact on daily life, this also brought them anxiety, which is why one of our recommendations is that this type of patients with this profile, they have more support in terms of mental health.
That's absolutely right. Lastly, what do you think some of the policy implications are? With the findings you have, how would you present this to policymakers or public health officials, et cetera, on how the messaging should be done about asthma and or other chronic illness and patients' health-seeking behavior?
I will say that the key strength of all this research that can be recommended for health policymakers is that, so we suggest that this engagement of the patient and the family in the management of asthma can be a way towards achieving better management, enhance quality of life, quality of care, and can reduce costs, health costs, and improve proficiency. This implies a more deliberate or proactive policy to involve patients' families in treatment programs, for example, in clinical procedures and patient management plans. I think that this wider perspective can inspire health professionals to see family as a shared knowledge and capability of the patients. So I would say that this would be our main message and recommendation with this study.
Thank you so much, Liliana. It's been quite eye-opening and to have this conversation with you.
Thank you so much, TJ. It was great to be here.
Thanks for listening to Beyond the Article, Health and Communication Distilled, a podcast of the Journal of Communication in Healthcare, Strategies, Media, and Engagement in Global Health. Follow the journal on Twitter at JCIH Online for news about the articles we publish and other resources. That's JCIH Online on Twitter.